Dr. Lillian Glass teaches speech therapy at the University of Southern California. She also has her own television show which focuses on improving the human vocal image. So welcome, Lillian.
Good to be here.
Now, what determines a pleasant-sounding voice?
Well, it's how you use your communication mechanism. When we speak about using the communication mechanism, we have to think about various aspects of the body. The breathing mechanism, the laryngeal mechanism or the voice box, the articulatory mechanism which involves the tongue, lips, teeth, the resonatory mechanism involving the sinuses, and also the psychological mechanism. Galen, who is a Greek philosopher, once said it's not the eyes that are the mirrors of the soul, it's the voice. Very true.
Yeah. So what's the most common mistake that people make?
Well, the most common is improper breathing. Most people don't breathe correctly. When we're a child, we're taught shoulders back, chest out, breathe. And so a lot of us, we breathe clavicularly, or from the upper chest area. And we're supposed to breathe from down in this area. We hear it termed the diaphragmatic area, or the diaphragm. But in essence, the diaphragm is just a thin tissue that separates the lungs from the lower intestines. But so actually the diaphragm is a misnomer. It's the abdominal muscles that should be used when you breathe.
Well then, so you have to really down to there.
If you look at, you have a lovely little dog out there that I saw today. We met, became friends. Your little dog, if you look at him, he'll breathe from his abdominal area. Babies breathe from this area. It's a very natural type of breathing to do. In fact, when we go to sleep at night, we breathe from this area. So it's very important to be in touch with that.
Well then, moving to the next thing then, how do you break the habit of talking too softly?
Well, one way to do that is to take a breath in, tighten up your abdominal muscles, and project it out like this. Okay? And if you look at singers, for example, Barbra Streisand is an excellent singer, and one of the reasons why is how she can carry a note for a very long period of time, and it sounds loudly. And the reason why she does that is because she uses her abdominal muscles, and she pushes the tone outward, and this is what we need to do.
Then what about talking too loudly?
Well, if we talk too loudly, sometimes we may have a hearing loss, and many people that talk loudly don't know it. Other people around them know it, but oftentimes they don't know it. So it's important to get your hearing checked to make sure that you don't have a hearing loss.
Well, that's good. Now, what about a nasal twang?
Yes, this is in fact in my private practice in Beverly Hills, this is one of the most common problems I have with people coming to me. They say, I have this nasal sounding voice. Why? Well, there are two causes for a nasal twang. One could be due to a physiological problem. It could be due to a cleft palate or a shortened palate, and this can be recognized upon physical examination. But many times people don't open their mouths enough, and that's why they sound nasal. If I talk to you like this, well, a lot of times I'll sound more nasal because it's not coming out orally. But if I open my mouth and enunciate, it's going to be more oral.
That's marvelous.
There's also a sex difference. More men sound nasal than women, and one of the information, some of the research that I've been doing has been on sex differences in communication. I'm doing a book on this very topic, and it's very interesting because men don't use as much oral musculature as women do in communication.
Oh, there's less animation. And
Yes.
is facial animation an important part of a good vocal image?
Absolutely. Because if you're talking to someone and you're not getting the feedback and you're just saying, you don't get the extra information that you need from that person. And it's so important to have good eye contact with the person and to look at the total face, not just stare in the person's eyes, but to look at the total picture and to use your muscles and to emote through your face.
Well, then how do we break the habit of, say, clearing the throat all the time?
Okay, this is a very common problem, and sometimes people that have throat problems need to see an ear, nose, and throat physician for help. They may have contact ulcers or vocal nodules or excessive postnasal drip that may produce mucus that may cause this to happen. So they may be clearing the throat. So a medical examination could be done. Another situation with throat clearing is done out of nervousness. There's all types of throat clearing behaviors that relate to coughing. There's a Pickwickian dismissal cough, so to speak, or throat clearing. And there's also a throat clearing situation where whenever you're in front of a person that you're uncomfortable with, you may clear your throat a lot. Or if you start a sentence, you may do this. So one way is to just be conscious of it and to substitute another behavior like swallowing, which is less damaging to the vocal cords.
What about a nervous habit like hemming or hawing?
Yes, this is very common. Many times we are not focused on what we're going to say. The reason why we hem or haw or is because we're not tuned in to what we're talking about. Many of us play the game, I think that they think that I think that they think, and are they thinking that I think, and am I? And if they eliminated that and got right to the issue at hand and concentrated on what the topic was, they wouldn't have that problem. Now, stuttering is a problem. Most people do stutter, though. I just stuttered by saying and that's very common. That's very normal. There are different types of stuttering. People may have a stutter where they go and this is called a tonic block. There's also a clonic block. For example, a person would go dog and would have problems pushing the sound out. And these type of stuttering behaviors require therapy.
Oh, I see. Well, now what about accents? Some accents are really very charming, but they can also be problematic.
Yes, and I'm glad that you brought this issue up. In my private practice, that's one of the things I specialize in. With actors and actresses, I teach them accents and dialects. I teach them how to get rid of them and how to gain them for various roles that they're going to do. And it's very interesting. A story was once told to me by a professor at the University of Minnesota. He was one of the leading professors in his area in psychology. And one of the things he did was he would give a lecture in this southern drawl. He'd have this really thick southern accent. He'd talk like this. And he gave this one important lecture with his colleague who had a British accent and talked like this. And more questions were directed to his assistant than they were to him. And it was due to the accent. So accents can be charming unless they interfere with your intelligibility. There are some accents that there are prejudicial accents. If there's a problem in the world situation, there may be prejudice exhibited throughout society towards people with that accent. And unfortunately, we'd like to think we live in a democracy and this doesn't happen, but research contravenes this because it does. So oftentimes people may need help with those types of accents.
Marvelous. Oh, well, thank you, Dr. Lillian Glass. You've helped us to learn to pay more attention to our vocal image. Very interesting. I'll return to talk with John Hillerman, who changed his vocal image from a Texas cowpoke to a crusty major domo.